Zolpimist, also known as Zolpidem, is a medication used for a short time to treat insomnia in adults. If you have trouble falling asleep, Zolpimist can help you fall asleep faster, so you can get a better night's rest. It belongs to a class of drugs called sedative-hypnotics, and it acts on your brain to produce a calming effect. The recommended daily dosage of Zolpimist is usually 5 to 10 milligrams, and it is typically taken right before bedtime. It's important to follow your doctor's instructions and only take Zolpimist as prescribed. Before using Zolpimist, make sure to read the medication guide and the patient instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Prime the product according to the instructions before you use it for the first time, and if you have not used it for at least 14 days. Point the spray away from your face and other people while you are priming it. Spray this medication into your mouth over your tongue as directed by your doctor, usually once a night. Since Zolpidem works quickly, use it right before you get into bed. Use it on an empty stomach. Do not use it with or right after a meal because it will not work as quickly. Do not take a dose of this drug unless you have time for a full night's sleep of at least 7 to 8 hours. If you have to wake up before that, you may have some memory loss and may have trouble safely doing any activity that requires alertness, such as driving or operating machinery. Dosage is based on your gender, age, medical condition, other medications you may be taking, and response to treatment. Do not increase your dose, use it more often, or use it for longer than prescribed. Do not use more than 10 milligrams a day. If you suddenly stop using this medication, you may have withdrawal symptoms. To help prevent withdrawal, your doctor may lower your dose slowly. Tell your doctor or pharmacist right away if you have withdrawal. Though it helps many people, this medication may sometimes cause addiction. Take this medication exactly as prescribed to lower the risk of addiction. Ask your doctor or pharmacist for more details. When this medication is used for a long time, it may not work as well. Talk with your doctor if this medication stops working well. Tell your doctor if your condition lasts after 7 to 10 days, or if it gets worse. You may have trouble sleeping the first few nights after you stop using this medication. This is called rebound insomnia and is normal. If this effect continues, contact your doctor. If you experience dizziness while taking Zolpimist, be sure to let your doctor or pharmacist know, especially if the dizziness persists or worsens. Also, inform your doctor if you feel drowsy during the day, as your dosage may need to be adjusted. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks of side effects. In fact, many people taking Zolpimist do not experience any serious side effects. However, it's important to contact your doctor immediately if you experience any of the following serious side effects: memory loss, changes in mood or behavior, such as worsening depression or thoughts of suicide, hallucinations, confusion, agitation, aggressive behavior, or anxiety. While rare, if you have a severe allergic reaction to Zolpimist, such as a rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of potential side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Remember to always consult your doctor for medical advice about side effects. There have been rare instances where people have engaged in activities such as driving, sleepwalking, preparing/eating food, making phone calls, or having sex while not fully awake after taking Zolpimist. They may not even remember these events. This can be dangerous and potentially fatal to themselves or others. If you experience any of these activities after taking this medication, it is important to inform your doctor immediately. If you have had this reaction to this medication or similar ones, such as Asopiclone or Zalplan, you should not continue taking them. Before using Zolpimist, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This includes kidney or liver disease, mental health issues, substance use disorder, sleepwalking, lung or breathing problems, and muscle disease. It's important to note that the effects of Zolpimist can last into the next day, and if you didn't get enough sleep or took other medications that make you sleepy, you may feel alert but not think clearly enough to drive. This medication may also increase the risk of falls, and it's important to avoid alcoholic beverages while using Zolpimist. It's also important to talk to your doctor if you are using marijuana. Children and older adults may be more sensitive to the side effects of Zolpimist, such as dizziness and excessive drowsiness. Before having surgery, be sure to inform your doctor or dentist about all the products you are using. During pregnancy, Zolpimist should only be used when clearly needed, as it may have effects on the baby. It's important to discuss the risks and benefits with your doctor. A small amount of this medication can also pass into breast milk, so it's important to consult your doctor before breastfeeding while using Zolpimist. It's important to be aware of potential drug interactions when taking Zolpimist. Certain medications, such as sodium oxybate, can interact with Zolpimist and affect its effectiveness. Other medications that can affect the removal of Zolpidem from your body include azole antifungals, rifampin, and St. John's wort, among others. Taking Zolpimist with other products that may cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, and antihistamines, may increase the risk of serious side effects. It's important to talk to your doctor or pharmacist about any other products you are taking and to carefully check the labels on all your medicines for ingredients that may cause drowsiness. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. And remember, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Zolpimist and is experiencing severe symptoms like passing out or having difficulty breathing, it's important to seek immediate medical assistance. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include slowed breathing or being in a deep sleep from which you cannot be awakened. It's crucial to get help right away in these situations. Always follow the recommended dosage and use Zolpimist as directed by your healthcare provider. It's important not to share Zolpimist with others, as it is against the law to do so. As we age, our sleep patterns may change, and we may experience interruptions in our sleep throughout the night. It's a good idea to talk to your doctor or pharmacist about ways to improve your sleep without medication, like avoiding caffeine and alcohol close to bedtime, skipping daytime naps, and going to bed at the same time each night. If you happen to miss a dose of Zolpimist, it is not recommended to use it unless you are able to dedicate 7 to 8 hours for sleep afterwards. This is important to ensure the medication has enough time to work effectively. Make sure to store Zolpimist upright at room temperature and away from heat. It's important to keep all medications out of reach of children and pets. When it comes to getting rid of any leftover Zolpimist, don't flush it down the toilet or pour it into a drain unless you've been told to do so. Instead, make sure to properly discard it when it's expired or you no longer need it. If you're unsure about how to do this, it's best to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.